than would be expected, given the tough restrictions that are already in place. And I also received an explanation for why the virus is spreading more rapidly in these areas. It seems that the spread is now being driven by the new variant of the virus, which we spoke about earlier this week and learned about earlier this week. Our advisory group on new and emerging respiratory virus threats, NERVTAG, has spent the last few days analysing this new variant. There's no evidence that it causes more severe illness or higher mortality, but it does appear to be passed on significantly more easily. NERVTAG's early analysis suggests the new variant could increase the R by 0.4 or more, and although there's considerable uncertainty, it may be up to 70% more transmissible than the old variant, the original version of the disease. This is early data and it's subject to review.
Halevich, the UK discovered a new strand of coronavirus, doctor, in southern England. Officials are saying that there's nothing to show it will cause a more serious disease, but analysis is suggesting it's a new variant. It's growing faster than existing variants. What can you tell us about this new strand and whether it impacts the effectiveness of the Pfizer vaccine?
Maria, it is really too early to tell. The new strain of virus is a common occurrence during any pandemic. Viruses typically evolve. Fortunately, they typically evolve into the strains that are less virulent, meaning less dangerous. Right now, it's too early to tell. How is this going to, if at all, affect the efficacy of the vaccine?
Restrictions on people coming from the UK as a new variation of coronavirus spreads rapidly there. Belgium, the Netherlands, Austria and Italy have all announced restrictions, including bans on flights and trains from the UK. France and Germany are said to be considering similar action. This comes after British Prime Minister Boris Johnson announced tougher measures to combat the new strain. Officials say while the new mutation is much more easily transmitted, it's not thought to be any more dangerous.
Deal with a new strain of coronavirus that's emerged in southern England. It's a leading scientist is calling it, quote, a real cause for concern. The CBC's Dominic Velitis has more. Dom, let's talk about what we're learning about the concerns and the more that we're seeing today. What's the latest?
Yeah, John, those concerns are certainly growing about this new strain and really the general picture in the UK, especially in England, where cases are surging and hospitals are nearing capacity. Now, Boris Johnson reportedly chaired that emergency meeting with ministers last night. They have been meeting again today. A press conference is going to be held in about an hour. But we also know, John, that Boris Johnson has held a conference call today with the leaders of Wales, Scotland and Northern Ireland. Off the back of that meeting, Northern Ireland's Arlene Foster described this new strain as very concerning. Scotland's Nicola Sturgeon said preventative action may well be needed. About 1,000 cases, John, of this new strain have already been identified in nearly 60 parts of England, but the numbers are said to be increasing rapidly. Chris Whitty, who is the chief medical advisor to the UK government, has now told the World Health Organization that this new strain can spread more quickly.
Plans have to be cancelled to avoid the NHS being overwhelmed. So how much of a threat does the new strain pose to hospitals? Well, we'll ask that question now to the BMA's Chair of Council, Dr. Chand Nagpal. Thanks very much for coming with us today. So the Prime Minister said yesterday hospitalisations are rising in London, the South East and the East of England. What are you seeing?
Well, today we've just published the results of a major survey of doctors' experiences in the NHS over the last week. And it, in fact, paints a really bleak picture. Doctors are saying they're overwhelmed. They've seen a massive surge in COVID cases, 1 in 3 saying even more than during the first wave, but also a massive surge in non-COVID patients, so that they're actually saying they don't have the capacity, the ability to manage both, and 9 in 10 say they're not able to provide patients with the care they need.
Making sure we're using the proper wording. So it's not actually a new strain. So what happens is when you have a virus, such as the one we have now, it's common for the DNA to mutate. That's expected, it's common, it randomly happens. Some of these mutations are good, some of these mutations are bad. Just because it's mutating doesn't necessarily mean anything one way or the other. So when enough of these mutations occur in the genetic material that it changes the actual biological property or function of the virus, that's now a new strain. So what we have here is not a new strain. It's basically the same exact strain that we've been looking at that spread across, globally pretty much. What we have here is an isolate. So an isolate is just basically where we see those same mutations in the genetic material, but they just haven't accumulated enough or changed to such a degree that the biological properties are any different. So when we're looking at this isolate, what they're saying is particularly they're looking at the proteins that form the spikes on the surface of these coronaviruses. So you've seen the picture of like the spikes coming out, right? And so they've actually tracked that there's been about 14 or so of these mutations in the proteins that comprise these spikes that are they've seen spread across globally. And of these, there's one in particular that they see the most commonly. And so they are hypothesizing or speculating that because it's so widely transmissible, because it's so widely spread, that this might be due to the fact that this mutation causes the virus to be more infectious. But again, this is their hypothesis. So, and it hasn't actually been proven yet. There's still a lot more research that needs to be done in order to prove that this particular mutation makes the virus more infectious or transmissible.